Hello, my name is Dr. Mohsen Rani, and I'm building a virtual mental health platform that makes clinicians more efficient and get patients more engaged with their care. There are 60 million people living with mental health problems in US and Canada, but more than 40 million of these patients do not receive any care for their problem. That is because the current system of delivery of mental health care is inefficient, expensive, and inaccessible. And given the size of the problem, we simply do not have enough clinicians to provide care in traditional face to face and live format. And this is bound to get worse, with more than half of psychiatrists practicing today retiring by 2025. While it is not possible to increase the number of clinicians in the short term, we could increase the efficiency of the time they spend with each patient, and that is exactly what we do at Oppt. Oppt is a digital behavioral health platform aimed at healthcare organizations to increase their workforce efficiency and patient care capacity by up to 4 times. Our platform equips care providers with the smart tools designed to support, monitor, and interact with their patients mostly synchronously and continuously while increasing their efficiency. Using our solutions, we have shown 25 to 45% symptom reduction in a range of diseases from depression to anxiety and personality disorders. So, how do we do that? We equip care providers with structured disease-specific digital care plans, which include everything from therapeutic content, session-specific feedback templates, and personal training for each specific disease. Our solution is powered with our proprietary AI algorithms that assist the clinicians in writing and personalizing their feedback, help with patient triage and treatment outcome prediction, and allow for remote mental status monitoring outside the clinical setup. So, the care provider assigns pre-designed disease-specific modules to their patients. Patients go through the content on their own time. At the end of each session, there is a homework that patients submit right on the platform. Clinicians only provide personalized feedback to patients' homeworks and skip repeating general points across different patients. This way, they can handle 4 patients in 1 hour instead of one. At the same time, we collect more than 25 different clinical, behavioral, and physiological benchmarks and provide analytical feedback to the clinicians about patients' progress, make predictions about the care outcome, and provide suggestions for the next step, based on which they could continue the course of therapy or adjust it, for example, by adding medications. Most importantly, we know these solutions work as we have validated our therapeutic modules across 8 clinical trials and more to come soon. This is one of our biggest advantages to any other solution in the market. Our business model is a subscription-based model charging per number of patients served on our platform yearly and charging extra for more specialized care plans like addiction or chronic disease management such as cancer or diabetes. The annual healthcare expenditure for mental health problems is around $250 billion, and $2.3 billion is this belongs spent on behavioral health software and infrastructure, which is our main target. However, I should note that these numbers belong before COVID. In fact, since last March, there was a 20 to 30 times growth in the virtual care market, and now the distribution looks more like this. So the need is extremely high, and the time is prime for us in the market. We are really excited on closing a major enterprise and channel partnership deal with the third largest Canadian telemedicine company this summer. Last December, EQ Care was acquired by the largest Canadian telemedicine company, TELUS Health, with 3 to 4 million users under coverage. Last year, we had close to $150,000 revenue, and our target for this year was around $450,000. We have already achieved $200,000 so far in 2021 and are on track to pass our target for the year. And we have the perfect team to actually do this. We are not a bunch of developers that suddenly decided to solve the mental health problem. Our solution is based on many years of research experience. Our Chief Medical Officer, Dr. Alavi, is a psychiatrist at Queen's University and a pioneer in the field of online psychotherapy with 14 years of research experience. I'm a medical doctor with a PhD in neuroscience and postdoc in computational neuropsychiatry, and an expert in combining basic science research with clinical practice. Given our expertise in the field, Dr. Anavi and myself have been commissioned by Springer Nature to write the first handbook on how to do online psychotherapy. So we have literally written the book on this. Our solution was the winner of the 2018 Mental Health Innovation Zone Award at the American Psychiatric Association, and we have partnership with the most reputable incubators in the field. We are now raising $2 million US in a seed run and looking for a lead investor. We have just closed a $200,000 investment with another strategic partner in the fall and have around $1 million soft commitment towards our goal. Our biggest target for the use of funds is to expand our business development activity in the US market. Before I finish, I'd just like to leave you with this mind-boggling graph. Here you can see the number of telehealth claims each month in US over the last 2 years. The number of behavioral health claims rose 30 times within just 2 months. And while there was some drop, it is still by far the biggest share of telemedicine market. So the time is now. Thank you very much for your attention. I would love to answer any questions.